Welcome to the Virtual Learning Circles. Thank you so much for joining us. I want to first thank my team, Suzanne Morris, Marcus Sabs, Gabby Durden, and Dr. Cassandra Brentley are members of this work that continue to support us each and every month. So thank you so much for all of your work. And this space, for those that may be new, is really designed to bring together community service, policy, philanthropy, and research leaders who are working at the intersection of social change and well-being in our region. And today's virtual learning circle, which I think is very appropriate to have during Black Maternal Health Week, is all about how employer policies, including access to healthcare and paid family leave, can impact outcomes for families with newborns. We're also going to discuss what barriers exist within these systems and what steps we can collectively take to ensure that families have a positive start. And we've got two excellent local leaders who are really pioneering the way. And in particular, I think what is most valuable and important here is that both of these organizations engaged very closely together during the Investment Advisory Council pilot planning sessions. And from that, a lot of work has happened collectively. And we're especially grateful to have Yasmin, who is a newly hired director at Healthy Start, who is leading the charge with the Allegheny Birth Initiative. With that, I'd like to do a formal introduction to both of you, and then we'll jump into the conversation today. So Yasmin Bennett Kelly is the director of Allegheny's Birth Initiative. As a former manager and equity advocate for Pittsburgh Public Schools, Yasmin earned a reputation for her ability to engage stakeholders in conversation about racial equity and intersectionality. As the director of Allegheny's Birth Initiative, Yasmin is committed to shifting the narrative of Allegheny County by prioritizing community and collaboration. Mike Stansel is the CEO and president of Pittsburgh Business Group on Health, vice president of Bridges for Health Equity, and co-founder and CMO of Lificent. He earned his bachelor's degree from Slippery Rock University and his master's degree from George Washington University. He currently serves as the Executive Service Corps through Bayer Center for Nonprofit Management and is a member of the Pittsburgh Business Times Leadership Trust and was selected one of the City and State's Power 100 for 2023. So with that, Yasmin and Mike, thank you so much for sharing your expertise with us today, and we are looking forward to a full conversation. One of the things that we like to do in this space is give the audience a chance to get to know each of your organizations a bit more. And given how deep your work intersects with the commitments to increasing health equity and including policies and support of the business community and new moms, we'd like to start just sharing a little bit about your organization before we jump into the topic of the day. So with that, Yasmin, would you mind sharing a little bit about Allegheny's birth initiative at Healthy Start?
Absolutely. So I'll start off by saying that Healthy Start has been in this field in maternal and infant health for over 30 years now. And about a few years ago, I won't say specifically how many, but about a few years ago, we moved from focusing more on direct service and started focusing on real systemic change. And so that really explains how we got to this birth initiative, also known as the birth plan. And so the birth plan is the community's response. To our issues and our racial disparities when it comes to maternal and infant health. And so the community, many stakeholders, many leaders came together and they decided on a few different action steps that can help us to reduce infant and maternal mortality in Allegheny County. And so this is a really comprehensive plan that includes many different parts, including childcare, workplace policies, social determinants of health, and many other issues that including obviously systemic racism and addressing systemic and institutionalized racism in Allegheny County. It's really just a culmination of those different things and some action steps to figure out how we can address those issues. You're muted, Robin.
Thank you.
Thank
Mike,
you.
would you mind sharing a bit about the Pittsburgh Business Group on Health?
Sure. So the Pittsburgh Business Group on Health is a coalition of employers. We have employer members that work together to create better healthcare for their employees. So inherent in that mission is this need to pursue equity because no matter how rich your benefit offerings are, if they aren't equitable, then they aren't truly being implemented effectively. So we're currently involved in several multi-year grant-funded activities through the Heinz Endowment and through Highmark Foundation, focused on equity in maternal and infant health. We even launched a separate 501c3, which is Bridges for Health Equity, because we recognize the need to focus even more employer energy on these issues. And so we felt that that actually deserved its own branch and its own sort of center of focus. So we're excited about that as well. The other piece of this, coming from the employer perspective, is that it's not solely a social issue for employers. The truth is that equitable outcomes are beneficial all the way around the board. Healthy employees are as important to the bottom line as any other policy, and there's waste in poorly implemented strategies. And so while that might not be as mission driven or sound as sort of heartfelt, I think is a lot of like the equity issues deserve, that's a piece of it that to us shows that there is no excuse not to be involved. When we talk about sort of the empathy side of things and the real stories, and this has not been my lived experience. So when I hear stories of Black mothers and people of color and the inequities that they've been exposed to, that's an empathy experience for me, and that is something that hits me hard. But there's more than that on the sort of the business side of things, and there are some people that are not as receptive to that as I am, and so we find it incredibly important to say, look, this doesn't matter. It doesn't matter if you agree or if you're moved in a sense of empathy. This is a best practice. Equity is a best practice. So that's how we continue to move forward, just kind of charging through any of the whatabouts and have you thought abouts, right? We're just trying to steam forward, and we've got a great body of members that are helping us move that forward.
Absolutely. And I think one of the pieces that keeps coming up in the early childhood space is the need to connect more intentionally the business community to the issues that are impacting families and with young children in a more intentional way. And so with that, Mike, I'm curious to know more about just you sharing how the employer-led healthcare plays a role in supporting families, and especially those from historically marginalized neighborhoods, and what the opportunities are that you're most excited about this year.
Yeah, so one of the things that you said that I think was one of the concepts that I think dissolved in the middle of COVID after the murder of George Floyd was this concept of the business community. And I think for a long time, businesses and employers kind of got away with that idea that they were a separate entity outside of the community, right? And when those events happened, those distinctions dissolved away, right? We employ, as an employer, you are employing people that are a part of the community. Therefore, and your offices, your places, your physical locations exist within those communities as well as your members. Employers are a part of the community, right? Long story short, that distinction is a false one, and somehow has allowed us to sort of stay out of the conversation in an effective way. So that's one of the things that I think has shifted substantially. But I mean, on a more pragmatic level, employers are the biggest purchasers of healthcare products. If an employer is self-insured, meaning they pay for the care, they have all that claims data available to them. They are able to look at that. They are able to determine outcomes and the quality of care that their employees are receiving. And so in that is not only financial responsibility, but it's a responsibility to their employees and the outcomes that they're getting. And if that's not being implemented in an equitable way, or if you're seeing certain portions of your employee population are not getting access to the care that they need, then that's going to affect you. That's going to affect them. It's going to affect their families. It's going to affect their stability. And we've seen that the 2019 gender and equity report put out by the city of Pittsburgh was just an absolutely, I mean, pardon my language, but it's a damning report for the city of Pittsburgh. And we have a role in that. We have access to that information that can help us shift that. So for us, the initiatives that we've sort of began working towards, and it's I'm not going to sit here and say that we've figured everything out. One of the big things about this is this is all tied into systemic racism, and by that very nature, there's not a silver bullet, right? It has to be a systemic approach and a systemic fix. And we are a part of that larger system. So we're doing what we can to sort of help course correct that, but I'm not going to say that we've got all the answers by no means, right? It's an in-process thing. So we have a health equity series, which was a new thing for us as an employer-facing coalition, because that health equity series is a 3-part series that's public-facing, because we felt that one of the biggest barriers to people advocating for their own care or understanding the disparities and how to communicate those was that the population itself, the employees, the people that are not engaged in these conversations, they need to be brought up to speed. They need to be told that their experience is not unique, that this is a systemic issue and that there are people working, and that they have the power to ask and they have the power to talk and go to their HR leaders and their employers and hold them accountable and ask them to steer in that direction. And so it became important for us to start offering these more public engagements to arm them with the vocabularies and the information to actually advocate on their own behalf, while at the same time letting them know that there are people out there making these, working and taking these strides to address these issues. And then we were also, obviously we were part of the birth plan. And then we have the Maternal and Infant Health Equity Project through the Heinz Endowment, which is this is the thing that I think I'm most excited about, but it is also the most sort of in process right now, which is we're really trying to dial in what employers can do. We're trying to put together a blueprinted, repeatable step-by-step action to address inequities in their organizations and outcomes in their organizations. We're in our 2nd year of doing that work. We're in the process now of really tying in subjective experience. I think one of the biggest things that we have to, as employers, we have data, right? We have a lot of information about outcomes and costs and pricing. But one of the things that we've recognized is that if one person goes in to, maybe see the physician and they're getting their blood pressure checked, the doctor comes in, how's your kids? How's that knee surgery healing up? Take the blood pressure, they exchange, talk a little bit and leave. Somebody else comes in, the doctor comes in, takes their blood pressure, leaves, sends them on their way. The same data is captured from a claims perspective. That blood pressure was checked, it was sent, but the experience and the information and the things that were conveyed during that interaction make all the difference in the outcomes and the long-term results of that treatment. And of course, right, the more intense that work needs, the condition that's being treated is, the more important that dialogue and that ongoing information. So we're really trying to figure out the best way to capture that information, because as you might imagine, most people aren't excited to talk to their employers about what their doctor visit was like, and there are HIPAA laws and there are things like that. So that's something that we have to figure out, right? It's not impossible, but it needs to be done. And then I'm getting long-winded, so I apologize, but I want to say the thing that I'm really excited about is that we are in the early stages of partnering with NALU Solutions, who does training for DE&I for employers and HR benefits practitioners, to put together actually, I'm getting ahead of myself because that conversation's really early. So, but I just want to say we've got some upskill training possibilities here in the near future that we're going to be offering to the public, which I think can be really exciting. But I guess I shouldn't put the cart before the horse. I got to wait till that ink dries.
Well, that's some exclusive information, which is totally fine. So I would say the one thing that I'm hearing as a theme here, and this was something that also came up in some of the earlier conversations in the maternal health IAC group as well, is this need for more data transparency so that people are able to make the best decisions for themselves. And I would just be curious to know if now that you're in year 2 of what you just described, if there are some best practices or learnings that you think can be applied to push that agenda a little more broadly, so that the public does have what they need to hold people accountable too. I think that's the other piece, is that in this birth equity conversation, that's been a huge piece of the puzzle, is figuring out how do we equip both employers to make the right decisions around benefits and what's best for their family, the families that they are employing. But then also on the other side, how do I, perhaps as a woman who is going to have a baby, make the right determination on what should be my healthcare plan?
Yeah, and I think there are 2 levels of transparency there, right? So there's the transparency that has sort of already been in the process of being won, which is between your employer, if you're self-insured, having access to pricing and outcomes data from, like, the hospital systems and the actual providers. The next part of that transparency is then that piece of the employer communicating those recommendations, or acting on, like, communicating that information and then utilizing that to help communicate best decisions as far as where to go for care, or really making those decisions on the employee's behalf and communicating how they're doing that. Right. It's about, like, most employers are going to be actively looking at that data to make sure that they're getting the best bang for their buck, right? To make sure that their outcomes and right, that sounds sort of blunt, but it boils down to all of that, right? Their employees are experience is very important, but they have less control over that metric right now. So they take the metric that's available to them, and that's dollars spent and outcomes. And they need to be able to communicate why. They need to be able to communicate that to their employees. And then they need to be able to adjust their offerings in a way that address the issues that they're seeing in the data. So if there are certain hospitals that are just routinely having bad outcomes, say for maternal and infant outcomes for people of color, then they need to make those recommendations, and they need to be transparent about why they're making those recommendations, because I think a lot of the times employees don't see that. They just say, this provider is in network, go to them. This provider isn't, don't go to them. And there might be a lot more information behind that. And that empowers, I think, the employee, that empowers the patient to understand and to advocate for themselves further, if somebody's pushing them to go to one place rather than the other, if they know that those outcomes aren't good. So it's a multi-step process, and I think that's one of those things that we're working towards.
Yeah, it's really, you're lifting up something very important. We do want to shift to Yasmin for a moment here. So Yasmin, you are a part of the Healthy Start team, and Healthy Start is leading the charge to implement the Allegheny birth plan. It's a very comprehensive plan. I believe we can put the link to it later on for the audience in the chat. If you haven't seen it, we'll also send it in the follow-up. But it is really the roadmap for creating equity in this maternal health space, and what we've all committed to, I think, as a county at this point. And so could you briefly highlight for us the key goals of the birth plan?
Absolutely. So our first goal is to strengthen the MCH workforce, and that is the maternal and child health workforce. So this includes doulas, lactation support, childbirth educators, community health workers, midwives, mental health professionals, physicians assistants, any MCH worker that would come into contact with a birthing person and a child. And so the really key initiative in this goal for us is really to strengthen doula support, lactation support, and to professionalize those areas. And also we're focusing in the next few years of this grant, we're focusing on really strengthening our Black doulas in Allegheny County and to professionalize them and to make sure that they're being supported. And so, right now, what that looks like for us is having some really difficult conversations about systemic racism and about what that looks like for our doulas to enter into these fields, into this medical care system, and to not be supported. What does that look like to not have access to the women or birthing people that you're supposed to be advocating for? And so, part of strengthening that MCH workforce is really, like I said, just having those hard conversations, changing some policies, and making sure that doulas have access to their patients, that they're actually able to advocate for them, and that they're actually represented in the MCH workforce and in the medical field as being a professional employee. And so that's one of our first goals. And our second one is to strengthen systems of care. And so this looks like really examining different systems of care because, as we recognize, especially through the pandemic, through COVID-19, systems of care have begun to look very differently for all of us. And so we noticed that a lot of our community members are turning towards the community instead of going to traditional systems of care. And so we really want to strengthen and invest in those systems like home visits, family support centers, breastfeeding circles. Any type of circle or community effort, we really want to make sure that we strengthen those because we notice that a lot of people, if they don't get that investment that is required, they kind of fall back and they tend to not really be as supported. And we really need our community to be present to support these initiatives, especially with mothers, babies, and birthing people. Our third key goal is to address social determinants of health. This one in particular is something that really excites me because this is something that we're actually able to see in real time. And so some of you may notice, hopefully you've noticed that as you go to your doctor's visits, there's typically a screening now that includes addressing social determinants of health. It might not specifically use that language. However, it does ask questions about your meals, your safety, oftentimes about childcare, about access to transportation, access to affordable and healthy food. And so these are just some of the things that we're working on in the birth plan. And so right now we actually have a partner. Her name is Taylor Clem, and she has another individual that she's working with. And right now she has different cohorts of MCH workers that are attending her workshops to learn how to grow their own food and to kind of nourish themselves and nourish their communities. And so that really just speaks to how the birth plan is systemic and it's sustainable. And so the plan is for each individual, each MCH worker that attends these workshops, they will take the information that they learn and they will share it with the rest of their community and the rest of the mothers and birthing people that they interact with on a daily basis. And our fourth goal is to coordinate and streamline MCH initiatives. And so this is something I'll also probably speak about a little later in the conversation, but something that I've noticed since I've been here in this role, because as you mentioned previously, I've worked in public education. And so I've noticed in nonprofit, it is kind of traditional to work in silos. And so what I've been seeing is that a lot of people have been coming together who have the same initiatives and they want to reduce poor health outcomes for Black mothers, birthing people, and babies. We've really come together to streamline and instead of duplicating our efforts, we've really started to work together. And so what that's looked like for me over the past few months that I've been in this role is just kind of calling in and elevating the voices of the other people who are already doing this work and kind of just leaning into one another and figuring out how we can maximize our resources together.
Thank you so much for that. And do you want to talk a little bit about the specific elements that are connected to the employer policy?
Yes, absolutely. So right now we actually are working with Pittsburgh Business Group on health to develop an employer survey. So we're trying to figure out employer best practices for current and future parents. And so right now we're working with Diane, who's actually kind of leading this project with the birth plan. She's really great, love her. And so we're working on developing and administering a survey, a statewide and regional survey on workplace policies around future parents, including a few things: family-friendly employer practices, different definitions of family planning. I think this is extremely important as our language becomes inclusive, as families, not as they become inclusive because families have been inclusive, but as we start to acknowledge that families are looking differently these days. That's one thing that is just really important because a lot of times employers don't include that and they include this normative, heteronormative family. And we all know that family planning looks different for everyone. Um, Another thing we're focusing on is work schedules and flexibility. We just recently, not recently, actually, time goes really fast, but a couple months ago, we had our birth plan kickoff. We got a lot of feedback from our participants in the area of family and employer workplace policies. And so, something that was mentioned is a lot of times families feel like they can use a sick day or a personal day, but they feel like it's not really encouraged to do certain things like that to care for your family. And so that's something that we're working with Pittsburgh Business Group on Health to kind of really fight towards those issues and to make sure that we're addressing those things. Also, paid leave policies. We're working on figuring out ways for caregivers in general to have paid leave policies or be able to benefit from paid leave policies rather. And so, like I mentioned, families look very different. And so we want to make sure that we're being inclusive of what all families look like these days. And so those are just some of the specific elements under employer policies that we're working on.
Wow, I mean, there's so much that you're
There's
taking.
so
Yeah.
much.
But I think what I'm hearing both from you and Mike is there's a few things, obviously, but I think one of the pieces is at the core of both of your, your missions is centering one, the family, right, and what is best for the family, and really pushing and advancing equity in the way in which we all work together in this space, from the nonprofit side to the business side to the advocacy side. And I don't think we can really move this needle without the advocacy piece. That is abundantly clear that a lot of the work that you all are doing is on the education and advocacy piece to really make a change in our region. And so, Mike, I'm wanting to know a little bit more about what are the avenues that you're taking to engage business leaders and also kind of bridging the gap between community organizations and business leaders working more fully together in your work?
Yeah, so I think a lot of it is kind of what we're doing right here, right? As I mentioned when we first started, there was this false separation, right, where employers were kind of either isolating themselves or left out of the conversation. And as we had these just sort of crucial, just major events, those walls disappeared and disintegrated, and the opportunities for us to interact directly with our community partners just became much more apparent and much more available. So from our perspective as an employer coalition, we just began looking for anybody and everybody who was willing to plug in and offer us insights. As Yasmin sort of alluded, right, like our surveys that are going out for our employers are really level setting surveys, right? A lot of people don't even have visibility into what the current status is across the economy. And a lot of these questions and a lot of these surveys wouldn't even really be possible or gathered or accurately and actively put into practice without working with a community partner who has a way to implement that survey and can help us navigate next steps. And I think that's like one of the biggest things for us also is that employers, I think, have historically been the ones that are looking to provide the solutions for employees kind of in a vacuum, right? They're like, we're the HR professionals. We know the benefits that are out there. We are going to make the best selections and send them out. And instead, what we have seen and what we have discovered is that communication, that dialogue, that feedback, and that open communication with the community and our employees can really guide us to implement better policies that are more equitable and that are actually supporting our families in a way that is impactful and sustainable. And we're seeing just across the board that that's just good all the way around. There's no negative to it. It's just a positive thing. And so, from our perspective, working with the Allegheny Conference, you've got Majestic Lane, who is their chief equity officer there. They work closely with Vibrant Pittsburgh, with Sabrina Saunders Mosby, their CEO. They're heavily focused on DE&I and how that intersects with our local economy and our employers. We're out here working as well. And we are looking with to intersect and interact with anybody and everybody who has an idea of how we can have an impact on that systemic problem and how we can mark our place in that fix.
That's great, and kind of leans into the question about partnership a bit more. I think what I'm more curious about to just hearing that is, what resources do you feel like would be helpful in continuing to build those partnerships, and then also elevating what are the most critical needs for families right now?
So from a resources perspective, one of the things that I found just immensely valuable, and we had this wonderful at the Healthy Start kickoff where it was, the community was there, right? It wasn't just the partners, it was open to the community. So we had people who were living this and who this is directly impacting, engaging in the conversation. And as I mentioned sort of in the beginning, like one of our biggest struggles and that we're looking to solve with our maternal and infant health equity work is getting that subjective experience and finding a way to quantify that and to incorporate that into our solutions. And so resources that provide us with an open communication channel with the people that are actually experiencing these issues is probably one of the biggest things that's a challenge for us as an organization. And so any resource or any partner that is able to help facilitate that type of communication is only going to amplify our impact. From our perspective, like the resources that we offer, we do offer a lot of training and insights and directions to how to take a look at your claims data, how to analyze that. We have data partners who are able to extract demographic information and take a look at your total employee population and find where you might be having issues. So we have some of these resources available, and I think it's really the merger of those two that's gonna make a really big change. And then there was a second part to your question. And could you remind me of that real quick?
Yeah, it's just the question about how to elevate the most critical needs of families to make sure that they're really getting the resources and the access that they.
Yeah, that's right. And it was I think you were saying sort of what are the sort of immediate things that can be done. I'll say that the area that we have seen, it seems to be the path of least resistance to get almost immediate better outcomes is this. Yasmin mentioned earlier about doulas and lactation specialists and things like that. Implementing culturally appropriate care and making sure that your benefit packages as an employer are understand the needs of your employee base and your employee population and are offering those types of resources. It's a pretty simple thing to do. There are organizations out there that are actively working to get this access ready, but making sure that if your physician, if your employees need somebody from their community, from their demographic background, as a physician, that it offers a level of care that they would not otherwise get, when they don't have to code switch, when they don't have to worry about whether or not the physician that's caring for them understands their life experience. That has massive implications in outcomes. And so those are really easy, ready to make steps that can be taken. And so I think those are some of the high priority things that we can do right now that we're looking to help facilitate.
Thank you. And so Yasmin, the birth plan calls for a range of partners to really lean in to make these goals a reality and to increase positive outcomes for newborns and their parents. Would you mind just sharing with the audience what the strategies are that are being used to build the coalition of cross collaboration, and how you're including the business community in that?
Absolutely. So I'll say, transparently speaking, our coalition members are truthfully people that have already been dedicated to this work. And when I mentioned that a lot of individuals have been working in silos, it's really just bringing those folks together and saying, hey, we've seen the reports, we've listened to the stories, and now it's time for us to come together and figure out how we can address these issues as one. And so it's really just kind of a one mic, one sound situation where we really got everyone together. We got we have every single healthcare provider almost represented in the coalition. We have different community supports represented in the coalition. We have our human services represented and our health department represented in the coalition. So each and every organization and agency that has already shown their commitment to really wanting to reduce poor health outcomes for Black women, birthing people, and babies, we've really just gathered those groups together and said, we have the same goal. How can we work together to achieve those goals? How can we maximize all of our funding and resources to reduce these poor health outcomes? And I would say, as far as bringing the business in there, that just goes back to our need for systemic change, and we realize that we cannot do it without having each person and each entity represented at the table. And we know when we talk about addressing social determinants of health, we have to include that business aspect, because it's more than just community supports. It's more than that, and it's bigger than us. And so for us, it was really important to make sure that we did have that business and that HR representation at our table. However, I mean, I definitely will acknowledge that we need more folks at the table that can speak to that area. And also, not even just to speak to that area, but we need folks from that realm and from that field to listen to the stories of the other folks that are in the room and that are at the table, because a lot of those individuals typically are not in those spaces. And so we really think that it's important to kind of use our resources and to get some more folks that are in business.
Great. And what would you say would be like, if you had a magic wand and you could just paint a wonderful paradise for moms and children, what are the policies that you specifically think would really help move the needle for families?
I think one of the biggest things, especially right now, as I listened to mothers and birthing people, as I become one myself over the past 7 months, I think a really big thing is childcare. I think childcare and just being able to take leave, and like I mentioned before, not feel like you're going to be held accountable or punished for taking leave, for taking care of a child. Nowadays life looks different for all of us, work looks different for all of us. Children are missing school. There's always half days and cancellations, and there are all these different things. And it's interesting because the world expects moms to go to work, have a career, but also be a full-time parent. And that's no matter if you're in a two-parent household, no matter what your family system looks like, mothers still have to go to work and take care of their children. And so I think just having better policies in place for parents to take care of their children and to not be penalized for it, I think that's a really big thing. Also, just childcare compensation. I feel like that's another really big policy that we need to take care of. And I think ultimately all of these things benefit all of us, because these help our employees to have well-balanced lives. And another thing that came up in our kickoff, it was just a flexible need for start and end time for work, hybrid opportunities. We found out a lot of us work very well when working at home. People are able to complete everything that they need to complete, from whether that be home, grandma's house, a coffee shop. People can get their jobs done without being in office. So I would say definitely those policies for sure.
And Mike, we have time, so I'd love for you to also answer that same question.
Yeah, so a year ago, our focus, so each year our organization chooses a area of focus, sort of our mantra for the year. And last year's was people first. And I think it's really, and it was people first principles, because I liked the concept of, in healthcare, people are the first principle. That's where you start. When you're talking about caring for individuals, they're the starting point. And so I look at waving a magic wand. For me, it's policies and benefits and healthcare, starting from the point of a person, of that individual, of people, and addressing that based on their individual needs and what they need to in order, the support they need in order to be successful and to be healthy and to be productive. And that's that starting point, right? And inherent in that, if you just start with that and you work your way out, equity is inevitable. We are now, that's the magic wand answer, right? The truth is we're already in a system that is inequitable. So what we have to start doing is deconstructing that and start working towards deconstructing the inequities that we see. And I think that's sort of the important piece that we have to move forward, and dismantle that, to get to that ultimate thing where care is in fact, starting from that place of people first. I did want to mention that there are, Yasmin said that, right, for her, one of the biggest focuses are care, right? Care support, child care. Children First PA is an organization. Donna Cooper had reached out, and it's something that I definitely want to revisit, but I want to sort of speak it here because I think there are opportunities for this organization and people that are listening to interact. They have a mission to try to get state-sponsored childcare. There are other states that have implemented that type of policy. And they wanted to do a study of employers in the region, what type of care that is currently offered, and would they be opposed or unopposed, or would they be opposed or would they support having state-sponsored childcare? It's an interesting dynamic because oftentimes for employers, the level of care that they give is a differentiator that makes them competitive to potential employees. And so for some people, they don't like the idea of having state-sponsored childcare because that gets rid of one of their competitive advantages. And again, for me, right, this comes back to that idea, well, you're not thinking people first in that perspective. You're not thinking of what's actually best for the individuals. There are other ways of being competitive. There are other ways that you can build upon that. All that's doing is raising that baseline, and offering childcare to people that might otherwise not have that available to them. So that's a big thing that I think is within reach, and that if we get enough energy behind, we can elevate to a decent discourse.
I am finding it very interesting that we're on a call or a webinar about maternal health. And once again, what shows up is childcare. And I think that what this is emphasizing is just one, how you can't undo or untie one thing from the other, that this is very much so intersectional work that has to be treated as such. I also hear a deep need to really center families and what it is that is taking place, which is a lot of the philosophy and the work that we talked about in our February event as well, around early relational health and how critical it is for everybody, the business owner, the healthcare system, the business community and at large, philanthropists, researchers, to all think and start at the center with the child at the core, and then make decisions from there. And really acknowledging that. And I think hearing that you both have really emphasized just how much of a need we have to really start to pull down those silos and continue the charge for a collective agenda. So I appreciate your perspective so much. As we wrap up, we always talk a little bit with our guest and find out what's bringing them the most joy and happiness right now. So curious to know from Yasmin and Mike, what's bringing you joy?
What's bringing me joy right now is my daughter. As I mentioned, I am a new mom. My daughter will be 7 months on Saturday. And so just watching her learn how to crawl, try new foods, and just explore life has given me so much joy. What about you, Mike?
To be timely here, the sunny weather. Right now in Pittsburgh, we've got some beautiful days, and I am just soaking it up as much as I can. And I'm still also basking a little bit in the afterglow of a trip down to Orlando with my family at Disney and Universal, and it was just a great experience, and I feel re-energized, and I'm just sort of still glowing from that. I love my family and I love to spend time with them, so that was a great thing. And then to return to sun, what doesn't bring joy quite like that?
Yeah, absolutely. Well, it was great to have you both here today. And so thank you to those in the audience today that participated. We will hold our next virtual learning circle on May 11th, and our focus will be on childcare. I think it's a very appropriate segue given the conversation we had today. If you are still on the call and wouldn't mind sharing your feedback with us about this conversation, please scan the QR code. And with that, we wish everyone a wonderful afternoon. Thank you all so much for your time.
Thank you.
Thank you so much for having me.